Now we'll go ahead and I'll make the introduction for Dr. Maxie Gordon. We'll welcome him to the stage, but I want to say a few words about him first. Dr. Gordon will moderate the panel discussion on the multifaceted opioid crisis, emphasizing the vital partnership between law enforcement, community members, and healthcare providers. Dr. Gordon is a psychiatrist and internist with over 25 years of experience. He graduated from Belhaven University and Meharry Medical College, completing his residency in internal medicine and psychiatry at East Carolina University. Previously, he served as director of medical student education at the University of Mississippi School of Medicine and founded the Medicine Psychiatric Unit at Vidant Medical Center. A former president of Mississippi Psychiatric Association and a distinguished fellow of the American Psychiatric Association, Dr. Gordon advocates for mental health and addresses disparities in care. Currently in private practice in Clinton, Mississippi, he also consults for immigration and customs enforcement. Please join me in welcoming Dr. Gordon.
Thank you very much. I was noticing, I'll take a point of personal privilege here, that when I looked at my picture in the brochure, the picture looked like me. The problem with that is I actually sent them a picture of Denzel Washington in a white lab coat to put in for my picture, but that didn't happen. So we're happy to have a distinguished panel with us today, and I'm going to give you their names, and I'll let them, you have their bios and your information, and so I'll let them tell you a little bit about themselves. But what we're going to do today is actually talk about, we'll continue the theme of today, but this session is tackling the opioid crisis, police, community, and providers working together. First, let me introduce Chief Joseph Wade.
Good morning.
Chief of the Jackson Police Department.
Yes. Good afternoon. I bring you greetings from the 261 men and women of the Jackson Police Department. It's an absolute honor to be here. Thank you.
Okay. Next to him, we have Sheriff Tyree Jones, Sheriff of Hinds County.
Good afternoon. I bring you greetings from Hinds County and the Hinds County Sheriff's Office. It's good to be here amongst you all today. Thank you to those that are facilitating this event. We feel that this event is a well-needed platform for us to have a discussion about ongoing challenges in our communities and the things that we see and face. So thank you all for facilitating this. Thank you for inviting me to be a part of this discussion today also.
Next, we have Dr. Juvonda Hodge.
Thank you for inviting me. I bring you greetings on behalf of UMMC. I'm in the Department of Surgery, Division of Trauma. I'm over the burn center there, and we see a lot of patients who have either mental illness or substance abuse or both, and we get the end result when things don't go right.
Thank you. And finally, we have Chief Wesley Luckey, who's also a JD, who's with the Capitol Police.
Yes, sir. Thank y'all so much for allowing me to be here today. As always, I'm absolutely blessed to sit in front of a room full of distinguished individuals like yourself and be able to talk about things that matter and affect our community in such a big way. And I really hope that today, I look forward to the conversation. I hope that we can, find some solutions moving forward and talk about some resolutions of things that are going on.
Good. Very good. Good morning. So what we want to do first is open up the floor and have you all talk about ways that law enforcement is actually dealing with or tackling the opioid crisis, and maybe give us some insight into some of the things that you do to train your officers to handle people who have mental illness and who also have substance abuse issues.
Okay, I'll start. Again, good afternoon. We deal with these issues every single day in our community. As I sit here, we're dealing with it right now in the city of Jackson. As these officers go from call to call to call in our community. Of course, we know that our police officers are not mental health therapists or psychiatrists, but they are facing these issues every single day in our community. People that are suffering from mental health issues, people that are self-medicating when you talk about drug addiction, but it's not what it used to look like. When I came on the police department back in 1995, yes, I know I'm dated, 30 years, 1995, We were facing issues when you talked about drugs, you talked about crack, and you talked about weed. Drugs in our community do not look like that anymore. The addiction is your next door neighbor, it could be. When you're talking about painkillers and mental health issues and self-medicating, and we have to mitigate those issues every single day. We have officers that are trained through Hines Behavioral Health, crisis intervention officers who deal with people. They're called to the scene to deal with people that is having a mental health crisis. They deal with them because we know that incarceration is not the answer. Giving them the adequate help that they need to contribute or to re-enter society as a productive citizen is what they need. So those are some of the things that we're doing. I probably could talk for the next 6 hours, but I want to let my esteemed colleagues have something to say as well. Thank you so much.
All right. Sheriff Jones.
So just a little bit to echo what he said, but as far as training is concerned, he talked about his early days in law enforcement. It's the same for me. I'm a 25-year law enforcement veteran, but what we did 25 years ago does not match what happens today. There's so many more social issues that we have to address and deal with. But what we can say today is there's more training and resources that are available to address it. Are there enough? No, there's not. But there has been a lot of progress made over the years. Years ago, when you were a police officer and you responded to a call where someone was suffering from a mental health crisis or a mental illness crisis, 9 times out of 10, when you responded to that call, you had to go hands-on with them physically, right? And what did you do? You had to end up charging them. You took them to jail. You dropped them off. You signed an affidavit on them, and they did not get the treatment or the help that they needed, right? Well, today, we're able to more so identify with the social issues through training and through resources where jail should not even be an option from the beginning. We should not have to go hands-on or physical with these individuals because we have officers that are trained to talk. We have officers that are trained to de-escalate situations, and therefore you are able to get them the proper treatment and the proper help that they need. Because again, jail is not the place for them. Unfortunately, today, when we talk about social issues, we talk about mental health crisis, we talk about homelessness, we talk about substance abuse. Jails and prisons in our country are some of the biggest mental health institutions in the United States of America. People don't understand that because they see people that are incarcerated, right? But you have so many people in jail that suffer from mental health crisis. Now, we can't say that mental illness or mental health crisis are excuses to commit crimes, right? There are some that you can't differentiate between the two, but there are some that you can. And the ones that you can, and you have intervention and resources in place that would avoid them from finding themselves in jails, in prison, and they are afforded the help that they need to be able to be in society.
There's a joke among psychiatrists that the largest psychiatric hospital in the world is the Los Angeles County Jail because of the high rate that people with mental illness are incarcerated. A lot of times when people see these individuals in the community and they become frightened, they have no choice but to call law enforcement. So let's hear from Chief Luckey about his experiences.
So without echoing too much of what Sheriff Jones and Chief Wade said, another thing that I would add to that is all 3 of us have community engagement divisions that are also trained in crisis intervention training, which is a huge deal. It's a huge training for law enforcement these days, especially dealing with the social issues that we deal with on a daily basis, which is going to be your vagrancy, homelessness, mental health crisis out there on the streets. What these officers do is when they work hand in hand with third-party resource providers, NGOs, and they're able to respond to the scene, de-escalate the situation, evaluate the situation, and get the proper authorities and the proper resources to those individuals to do exactly what Sheriff Jones just said, and that's avoid going to jail, to avoid having to take them to the jail, because that's not the place for them. That's not the place they need to be. When they sit in jail, they're not getting the treatment they need. Now, if something happens, like Sheriff Jones says, we can't avoid the fact that criminal activity happens, and we have to also acknowledge that. We cannot just avoid putting everybody in jail that has a mental health crisis going on. But what we do have, one thing that's not talked about as often is the courts are starting to get more acclimated to this issue as well. The courts are starting to have resources as well that sit in during the hearings, during the trial days, and are able to provide those evaluations and those services also in the courtroom. So what that's going to do is that's going to help, Sheriff Jones in the future, to be able to get these people evaluated much quicker, these individuals that have these mental health issues, these mental health crises going on. And that's just two of the ways that I can think of that they didn't mention that we're trying to address the issues now.
All right. So, Dr. Hodge, I'd like to ask you as a person on the front line, and I'll give you a chance to kind of, think of some of the things that you experience. But you know that one of the things that we know that there's a positive correlation between adverse childhood experiences and substance use disorders. We also know that there's a positive correlation between substance use disorders and actually suicide. I read recently that the brain cannot distinguish between a broken heart and a broken foot, that to the brain, pain is pain. So if I have emotional pain, it becomes unbearable for me. If I have physical pain, we as psychiatrists know that people who have long-term physical diseases that are debilitating and painful have a high risk of suicide. But so do people who have emotional pain. So a lot of these individuals, and unfortunately they turn to drugs in order to find some type of relief. When you were in the 9th grade, you read a poem by a guy named Edgar Allan Poe called The Raven. And if you were in the 9th grade almost twice, like I was, you read it twice. But in that poem, he asks her something. In that poem, he asks the raven, he says, is there some nepenthe for me? And what he's asking is that, is there something in Greek mythology, a nepenthe was a potion that could ease the pain that you feel. And a lot of people are looking for their pain to be eased. So, Dr. Hodge, if you could share with us.
That's a big question. One thing that I've seen, I think, in the past, in medicine, 20, 25 years, is the ability for resources outpatient. They think, just bring the patient to the hospital, but we can't keep them there for 30 days.
Right.
We can't keep them there for 45 days. We have so many other patients to see. And as they've closed down inpatient psychiatric facilities, it became left to the community. Well, that system is not that great. It's hard to get into. Substance use recovery centers, number one, they have to be covered by insurance. Most of them are not. So you have someone who has limited financial resources, say, okay, go to recovery, and they can't afford it. So then they end up, you see them back in the ER with either overdose, or they have either experience violent crime, and the cycle just keeps continuing itself. Whether they do self-harm, they just, things that don't keep yourself safe, driving really fast, mixing drugs and alcohol, a lot of risky behavior. We see it, often starting when they're kids, and it continues. We actually, keep the data on that as kids, but as an adults, we don't. When you come in as a child to the emergency department, you're doing, let's say, burning trash with gunpowder at age 8. Like, okay, you're gonna get they're gonna investigate. But it's different with an adult. We don't have that same collection database and people kind of wrapping around and see, well, why are they doing this behavior? But honestly, the hospital is not really for long-term psychiatric help. I mean, the amount of beds that we have for inpatient pediatric psychiatry is probably like 8 for the state. So once you get, we settle you out with medication, then you're shipped out somewhere else or you're forced to go back home. If the mother cannot bring the child to their appointment or don't take their medication, it just continues. The same thing with people who are adults. A lot of times they burn a lot of bridges with the family because they don't have support to care for someone who has a mental illness and substance abuse in the house because they burn all their bridges. And you call the family, hey, he's ready to be discharged, and you hear like, click.
That's right.
We're not going to pick him up. So the availability of group homes for people who have substance use disorders with mental health is very, very limited if they don't have insurance. So they kind of just contribute to the homeless population. And they just, you keep seeing them, you know, they're just kind of a revolving door, unfortunately.
Thank you. Is there a coordinated approach? For example, if I'm an officer on duty and I know that someone has a substance abuse issue and may be under the influence of substances, is there a coordinated approach by the agencies where you have more than one officer go to attend to that person, or is it just the officer on the scene, or is that?
Well, yes. First of all, when we face these situations, when you talk about someone that is on drugs, using drugs, it's a very dangerous and volatile situation for law enforcement. And, you know, we're not able to test them prior to getting there, so we don't know if they're on opioids, fentanyl, heroin, PCP, something laced with something, or something they've just made up. We don't know. But it's a dangerous, volatile situation for law enforcement. And I'll give you one example. We responded to a call in Precinct 3. It was a man with a gun, and he was butt naked. And he had been shot. And didn't realize that he had been shot. He was so high. And guess who had to come deal with it? The Jackson Police Department. Fortunately, we didn't have to shoot him. We were able to mitigate the situation. And yes, I did say he was butt naked and had already been shot by someone, right? So those are situations that we deal with every single day. You know, we don't know whether he was on heroin, PCP, but I'm sure it was something really strong that the gunshot had no impact on him, right? So we have to send more than one police officer to that situation for their safety. We have to notify AMR and the fire department. But when they have those situations, they kind of hang back. They want the sheriff's department to go in first, Capitol Police to go in first, or us go in first to mitigate that situation because they're not armed and trained to deal with someone that's high on PCP or whatever it is that they're taking. So yes, it's a coordinated effort. We also put a premise history in the system. So we'll know that when we respond to that location, that there's someone there who's possibly abusing drugs, and it's something that we need to be on high alert about as we respond to that location. Thank you.
Well, I'll say this. If you haven't had to go physical and fight somebody that was under the influence of drugs, don't be jealous. You're not missing out on anything. Let me tell you. So, like Chief Wade said, you know, it's not only the substance abuse, but when you have your substance abuse, sometimes you may have mental illness associated with that. But just the substance abuse alone, these are some of the strongest individuals that you'll ever have to encounter if you respond to a call. So it's almost necessary that when you respond to the call, you take backup. And sometimes that backup may need some more backup. You may have 3 or 4 officers there to address one individual that can cause harm to not only one of you, but all 4 of you if he's not handled correctly. So your training instinct must come in, and you must have proper backup. Like he said, the premises history. And just last night, I was listening to the radio, and I heard a call for service go out to our deputies. And the deputies immediately recognized this address and the individual that was associated with this address. And the dispatcher got back on the radio and let the deputies know that we're responding, the premises history, the individual, and the type of encounters that had happened at this location prior. So before they even get there, they know that there's a strong possibility they may encounter this one individual and what could possibly happen when they get there. AMR, which is your medical unit, while we responding, they'll be staging. You may pass them sitting in the parking lot waiting for you to get there, right?
Yes.
Because they're not going to go until you get there for their own safety.
Right,
And if you remember what I was saying earlier about addressing individuals with mental health issues, substance abuse issues, 9 times out of 10, you had to go physical with them years ago. That has somewhat shifted and changed, but medical is not going to get involved until law enforcement gets there, but it's very, very necessary to have adequate amount of manpower there to address them. But again, if you can do it verbally and de-escalate that situation, then you've done something good and you've done something right by being able to de-escalate it verbally.
Very good.
Yeah, and that's exactly right. The only thing I would add to that is, we don't always know. It's based on the call. We don't always have the information we need when the call comes in. So, for example, you may have a passerby on 55 who sees an individual walking up the side of 55. Well, at that point, it's a welfare concern. It's somebody walking up the side of 55 who somebody is worried about getting hit by a car. That's happening quite a bit. We're seeing it in the news quite a bit.
Yes.
When officers respond to that as a welfare concern, and that's when they get out and realize, oh, wait, this is more than that. There's more going on here than that. So officers nowadays, they have more resources than, I started 20 years ago, 25, 30 years ago. So pretty good little stair step here.
Right here.
But there's more resources available today, just like Sheriff and Chief were mentioning. With our CAD systems, we're able to log a lot more information in there that's readily available to the officers once they even get on the scene. But the main thing is getting on the scene and realizing exactly what's going on and being able to get that manpower and that support back out there. Now, we do try to have, I mentioned our community engagement group, we try to have officers on each shift as well. All 3 of our agencies, we have officers on each shift that are patrol officers, not involved in that community engagement group, but they are crisis intervention trained. They are certified in that. So we do have officers out there patrolling the streets that come across these instances as well, answer these calls for service that are trained to know as well. But yeah, it's a bad feeling whenever you show up and somebody half your size hands you everything you ever thought you could get.
Yeah.
It's
Yeah, we know that drugs can have, just a detrimental effect in terms of people, but some of them, they're like things like PCP gives, it's an anesthetic, and so people don't feel anything once they're on PCP. So if, there was an incident that I won't, a few years ago where the police thought maybe the gentleman was on PCP because nothing that they did was able to get the person subdued. So you have that, and you may have a mental health crisis where the person has a bipolar disorder or something like that, and they already think that they're Superman and that they can handle anybody that comes along, and so that makes for a difficult call. Do you feel like you have enough resources from the community for mental health? Do you have a hospital that's a point of entry for you that you can reliably take people? I know that when I was with the University of Mississippi as the medical director of the inpatient psych unit, we only had 12 beds on each unit. We had 2 units and we had 12 on one. So the big University of Mississippi, had only 24 beds for psychiatric people in the city of Jackson. And so that's a big issue. Do you feel like you have a point of entry that you can safely take people to where they can get some help with their mental health issues?
Well, I think the answer is going to be unanimous up here.
yeah.
I'm going to take a while to think about it. No. No, we do not.
Yeah.
Because the sad issue is that we call AMR to transport these individuals to the hospital instead of incarcerating them, taking them to jail, and probably a couple hours later, you're going to see them again. Somebody has transported them to another part of town,
Right.
or they've been moved from South Jackson to Lakeland Drive, and now they're in Fundren, or vice versa. They've been taken from North Jackson to Merit Health. Now they're on Highway 18 panhandling or breaking in businesses. That is putting a Band-Aid on something that requires a tourniquet.
Right. That's right.
If that's the way that we're dealing with mental health issues and drug addiction in our community, we need more than a Band-Aid. But that's what we are dealing with every single day. We're the ones that is called to deal with these issues in our community, which are dangerous issues, and I understand the concern from the public. Nobody wants homeless encampments behind their home. Nobody wants you at the stop sign begging for money. Nobody wants you walking up and down the street. And the issue that's disturbing to me and something that we talk about all the time, most of the people that you see in your community is transients and vagrants and homeless individuals, people suffering from mental health issues are not from this area. They're not from Hinds County. They're not from Madison or Rankin County. Some of them are not even from the state of Mississippi.
Right.
They're from Chicago, Washington, D.C., Detroit. How did you get here? We are doing field contacts on these individuals to see who they are. You know, we had an individual, and I use this example all the time, he was breaking in Walgreens every night, going shopping after they closed.
Right.
And he would go shopping after they closed, right? When we finally arrested him, we did an operation, he was from Detroit, Michigan. He was not from here. So we do not have the resources that we need. We have got to take a holistic approach to deal with these issues. And it can't be that I'm gonna call the police. You're
Right.
not gonna police your way out of these issues.
So, Dr. Hodge, and I'll give you a chance to think about this. What resources can you kind of garner from hospitals to help with this? Because I know that a lot of times there's not enough beds. A lot of times people come to hospitals because they want to get more drugs. We used to have a gentleman who would break his arm, and he'd come into the emergency room and show us that his arm was broken, but we could see that he had broken his arm several times, and we realized that the reason he came to the emergency room after breaking his arm is because he wanted opiates. So what resources can we get hospitals to pitch in to kind of help with this crisis?
I mean, number one, psychiatry is underfunded. Psychiatry is underfunded.
Let me clap on that one, being a
Psychology is
psychiatrist. You
underfunded.
guys clap on that?
That's why a lot of the state institutions closed, because there was no funding in it. You talk about Merit Health, they have 18 beds, but they cannot get any more beds because if they have more mental health beds, it will make their level of reimbursement go down. So they want to have purpose for that hospital, but if you have too many mental health beds, your level of reimbursement for, let's say, a heart failure is going to go down because they're going to consider you a mental health hospital. So it's just underfunded, and that kind of leads to why we don't have a lot of resources. The residents, people going into psychiatry is less because they make less money. So it's just an ongoing cycle. The community resources are not there because it has to be covered by insurance.
That's right.
If I'm getting high every day because I have mental health trauma, then I'm not going to work. I'm not keeping a job. Once a child ages out of Medicaid at age 18, they're on their own.
Right.
And then all you see is just kind of like bad things that kind of go on. We had a gentleman who was maybe 18 or 19, mental health issues, substance abuse issues, kind of was burning a candle in an abandoned house, and he couldn't even figure out how to get out. He just went back into the fire, but was not from Madison, Hinds, or somewhere from California. Was kind of lured here to stay with a relative, and then they couldn't handle his mental health issues, and they just put him out. So that happens as well. There's really not a lot of wrap-down services for families, because at least in our community, if you have someone who's crazy, that's a bad thing.
Right.
You're kind of like, in the old days, we put them up to the country, and they say, okay, don't go up there, that's someone crazy lives up there.
Crazy,
But
yeah,
now,
right, yeah.
you know, they come to the city because we have resources.
Right. Well, that's true.
You can't panhandle in the Delta.
Right.
Yeah.
You're not going to get any money.
Right.
That's why they come to Jackson. They're going to
I
get some
agree.
money.
Yeah.
That's their vocation, panhandling.
I mean, we don't have enough social workers in the hospital, but the level of resources to send these people to, let's say, a group home or temporary housing is very, very limited.
Right.
I'm new to Mississippi, but compared to like Atlanta, we have even less. But if they have mental health and substance abuse, it's very difficult to place because they have to have insurance to pay for that. And then if you're outpatient, okay, I'm hearing voices and taking drugs, am I going to keep my appointment if no one calls me or picks me up? No. So you can document the patient got follow-up, but they don't have someone to kind of help them navigate the healthcare system to make sure they get to their appointments or taking their meds. We don't have a lot of task forces, let's say, to do a monthly sweep to, hey, make sure everyone's getting their medication, because it's not a priority.
Right.
So if you don't, the first thing is money. We don't have enough providers of mental health services in this area because it's underfunded. If it paid more, you would see a lot of centers.
Right. Sure.
You would see a lot of centers, but that's the first thing is lack of funding, lack of social work support. It's hard for us to keep social workers in the hospital because we don't pay enough.
And just to piggyback off of what she said about resources, 9 times out of 10, if law enforcement comes in contact with one of these individuals or however the call is, or you encounter one, you are going to most likely encounter somebody that's underserved, right?
Right.
They don't have the resources. They don't have the insurance. They don't have the funds, right? So when we talk about mental health resources, we talk about more resources. That needs to be geared more towards those that are underserved, that don't have the resources to be able to get it. Now, what we should not concentrate on more so is the ones that are here specifically to treat and help those that do have the resources, right? Because we're not necessarily benefiting from that with the social issues that we see on a day-to-day basis. They are able to treat people that can walk in, they have insurance to cover it, right?
Right.
They have the money or the money to pay for it. These are not the ones that we necessarily encounter on a day-to-day basis. I've gone to the state capitol. I think Chief Wade has, and Chief Luckey. We've all testified in the state capitol before several committees about some of these very issues that we are discussing. And I face it with our jail system. There's so many people that are detained in jail or waiting to go to trial, right? They need, or they are awaiting a bed at the state hospital.
Right. I know.
If there's no bed available at the state hospital, what do? They sit in jail for a period of time until that bed becomes available. And they are suffering from what we would consider seriously mental illness, SMIs, right? And we have to deal with them while they're in the jail. And what can happen while they're in jail? They can hurt somebody else, they can hurt
themselves
or kill themselves in jail, and we have to bear the burden of that responsibility. So when we talk about resources, there should be more resources, there should be more long-term resources, and there should be more beds available through the state to help us with these individuals that need to go to the state hospital for a short period of time or a long period of time. But the thing is, the resource is there and it's available for them.
Right. So we're about halfway through the session, and I'd like to open up the floor in case the audience has a question. But while we're thinking about that, I'd like y'all to, since we're trying to mitigate these types of problems, I'd like for each one of you panelists to tell me what would be your wish list for dealing with people with mental health issues. What would you want from the city and from the state and from community organizations? Now, I know one of the big problems, of course, is stigma. Nobody wants to be mentally ill, and nobody claims mental illness. I remember growing up in West Jackson, I would see people hitting their head against the wall and talking to themselves, and I'd say, he's got some kind of problem. And they'd say, nope. Somebody put something in his drink. Ain't nothing wrong with him. You guys heard that one before?
Yes.
So whenever I went to parties, I'd take my own Coca-Cola. So nobody would put anything in it. But this problem is they really had a mental illness that needed to be addressed. And a lot of times we have that. We have people who have never had their mental illness addressed. That's right. And that's a problem. And that's what community organizations are here for, to realize that this is a big issue, because these individuals are not only dangerous to themselves, but they're dangerous to law enforcement, and that's the main thing. So what would be your wish list in terms of resources from the city and the community or the state?
Okay. How long do I have? Well, before I answer that question, though, I do want to recognize and commend Ms. Helen Beatty.
All right, very good.
For getting all of us here today. Yep. Yes. Yes. Y'all do not know how hard it is to get the chief of police in Jackson, Hines County Sheriff,
Right.
and Chief Bo
Chief
Luckey
right,
at the
yeah.
same place and at the same time. That's a monumental task, so thank you so much. Yes.
Very good.
But, you know, my wish list, first of all, is simple. Let's make an investment in our community. Let's make an investment in public safety, because right now I see a disinvestment. And what I would love to see is also an investment in our youth and also educating our community. I get phone calls in the chief's office. Chief, he done went crazy, come and get him. Chief, I can't do nothing with him, y'all come get him, right? I don't operate a state hospital.
Right.
You know, I don't operate a youth detention center. So, you know, you mentioned something earlier about trauma. Ladies and gentlemen, we have people in our communities that are suffering. They're in a state of despair and destitute, right? You know, we're at a good place in life, but I go into homes in the city of Jackson, the first thing you notice, they don't have electricity. And it's 20, 30 degrees outside. Myself and Chief Banks were looking for a runaway kid. He had returned home. He had been jumped into a gang. And the mother wanted us to talk to him, but they didn't even have electricity, right? Those are the situations that we're dealing with every single day. So we look at things from an academic standpoint, we do. We look at it from a practical standpoint as well. And sometimes it's an ugly picture. It's an ugly picture because people are living in these conditions and circumstances. When you talked about trauma, I'm meeting with mothers weekly, almost every single day in my office, who are losing their sons in these communities to drug violence, gang violence, youth violence, domestic violence in our community. And a lot of these situations have that drug overtone and undercurrent. These kids now, let's start with them, my wish list. Let's start with the youth in our community at 9, 10, 11, 12 years old. Let's focus in on them because these kids now are seeing some traumatic stuff.
Right, absolutely.
Right, when I was a kid, you get to fight in the ballpark, you shake hands and keep playing, right?
Right, absolutely.
Now
Right.
they're coming back with an assault rifle, shooting up the whole park. And these kids are witnessing this. They're growing up with that trauma inside of them, and they're also losing loved ones to gun violence. So now you're talking about generational trauma in these families. So let's make an investment in the people that need our help, but let's also go in a prevent mode, a prevention mode to let's save these kids before they get to that point. The sheriff knows what we deal with every single day because he's housing these kids. 11-year-olds being arrested for carjacking. 13-year-olds being arrested for capital murder. Those are real issues in our community that we have to be honest about if we really want to address and fix this issue in our community. Thank you.
Thank you. If I may interject here, you're absolutely right, Chief, because, you know, I think it starts with doing things to help the youth in our community. You know, Frederick Douglass once wrote that it is easier to raise strong children than to repair broken men.
Yes.
And a lot of times what Dr. Hodge and I get are broken men that need repairing. And so if we could have a program or have programs that work toward helping children to develop, I think that would help us a lot on the back end. Okay, anybody else?
What's your wish list, Chief?
Chief Luckey,
In the spirit of what we're talking about, you know, when it comes to a lot of the social issues that we deal with, you know, having a place to take these individuals, you know, I would love to see more funding, more resources available for mental health crises,
Right.
for individuals that need this treatment. You know, it would be a huge, huge help for all of us up here if, you know, our officers were trained and we're working on the training needed for officers to deal with these types of issues. But if we had other professionals that would show up on the scene and take over and then actually have somewhere to take these individuals to where they could get the treatment they need and not just temporarily, if need be, they need to be there for the last 20 years, in my career in law enforcement, we've heard nothing but there's not enough beds. There's not enough beds. You ask, hey, is Whitfield taking anybody? No, there's not enough beds. It's always been for 20 years since I've been in law enforcement, and probably the entire 30 years that Chief Wade's been in law enforcement. There's never enough beds. This has been an ongoing issue. But the problem is we're seeing a rise in what's going on. We're not seeing our mental health system improve quick enough to meet the challenges of how much more mental health crisis we're seeing. We've dealt with it a lot, like I said, on a daily basis. And just to be able to provide these services that are necessary for these individuals that are out there that are lost and broken, and most of them are riddled with trauma. That's what you see when you really get into talking to these individuals, even the ones that are committing these crimes. They have this very traumatic childhood, this very traumatic past. There's something in them that is broken, and that's the reason why they're in the position they're in. And we're not in the position that they're in. We can never know what somebody else is going through. And certainly officers, we try the best we can to de-escalate situations, to deal with holistically the approach to mental health. But we're not adequately trained at this point to know what we're looking at, to really know what we're dealing with. So we have to resort back to law enforcement training. And I just think that it's a disservice to the individuals out there that need that treatment. So if we could find a way to funnel resources into the mental health crisis, to treatment and resources, that would be probably one of my biggest wish list items right now.
I said more money. On the trauma side, we are starting looking as a whole, like why do people commit violent crimes? And looking at what can we do to reduce the rate of them coming back. Because once they come in with one gunshot wound, most of the time they'll come back with something else. And the cost of society of that is very, 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 very high. I mean, 1 week stay in the ICU is almost $1 million. When you're talking about surgeons and anesthesia and everything else that goes along with it. So prevention costs a whole lot less than that. But people don't see the dollars kind of behind that. So as we start our violence intervention program at UMC, we're going to need community partners to say, hey, we have these, and it's going to be for patients between 18 and 34, kind of looking at, number one, how did you get in a situation, getting them with community-based organizations to partner with them while they're still in the hospital. Because oftentimes they get patched up and get right back out. So we need to hit them when they're at least down for a day or two, for someone to come in and say, hey, what's going on? To get psychologists involved with them to say, how can we get you more resources? It's not just fixing what's broken on the inside and then the brain damage is still there, so they're going to be right back. If they feel that there's nothing for them, there's despair, they're going to keep doing very high-risk activities or keep committing violent acts. So I think the university is committed to helping with this issue because we see too many young people whose lives are cut short, which is tragic. I mean, it's not uncommon to see, as I said, 13, 14, 15-year-olds who are, dying from gunshot wounds or left paralyzed or left with a lot of brain damage, and then you're putting a lot on the family, and then someone else they know gets caught up in this cycle. So more money for my psychiatry colleagues, for psychology, more community resources, and the hospital, we can't fix it all either. It's going to take all of us to really address this problem. We just get them when they're acute and everyone's coming down because it's a gunshot wound or someone, shot themselves in the head. But we see, more younger kids are committing suicide. It's not just teenagers. We had a 13-year-old who committed suicide. This summer, the mother told him to come off his video game, and he went outside and hung himself. So you think, what would a 12, 13-year-old, what is going on so bad that your mom says, stop playing the game, and you do that? But, are we able to go into that child's school to explain what happened to him? No, we don't have the resources for that. it gets investigated, but what support does that family get from us? Not much, besides saying, I'm sorry, your son has passed. And there's nothing that we, so we don't know what happened in the household. There's no wraparound. So that takes a lot of community, as well as hospital support and police support, because and then whoever had to go to that call, like, that's traumatizing. And some things you never forget. I mean, if you see a child that's lifeless, that's one thing you never forget. I don't care how hard or tough, these guys are all tough, but seeing a lifeless child, you never forget that. If it doesn't affect you, then you probably need some medicine yourself.
Yes.
So that's my wish list.
I'll be very short in the essence of time, but she's absolutely right. There are things that we see and we experience that it never goes away. We'll never forget it. You may appear physically tough, but there are things I've seen. We worked in homicide together several years. I spent about 12 years of my career working in robbery homicide. So there are pretty much things that I have seen and have been exposed to. It doesn't go away, So you have to be able to, first of all, acknowledge it, right, and be able to take care of your mental health just as well as you take care of your physical health.
Right.
If you saying that my physical health is more important than my mental health, right? If you've been exposed to some of the things that we've seen, then just like she said, yeah, you do need some medication. But I would like to see more investment, as he said, and Chief Luckey, and we all can agree in our youth. There are about 42 juveniles charged as adults in our jail in Hinds County today. We have about 820 detainees in our jail. That means they're at the age of 13 to 17. They're in juvenile jail, but they're charged as adults. When they turn 18, they come out of their jail, and they come into the adult jail. So we need to invest more in our youth. Chief Wade can attest, over the last couple of years, youth violence in the city of Jackson. Chief Luckey also has been on an all-time high, has been on a rise. But what we have to also understand, the hurt people, right?
People hurt other people.
Some of them have been victimized.
Yes.
If there's no treatment or help for them when they've been victimized, then what are they going to do? They're going to go and victimize somebody
people,
else.
Right, absolutely.
If there's no accountability, they are going to graduate in the opposite direction to a higher level of crime. My father always said to me, he said, if you lie, you steal. If you steal, you'll kill. If you're not being held accountable for the lying and the stealing, then eventually what will end up happening? Somebody can seriously get hurt or somebody can lose their life. So there has to be an accountability factor in there, but there also has to be an acknowledgement factor. Let's acknowledge this is the problem, and what can we do to address this problem before it gets out of hand and we can no longer address it.
Very good. Question from the audience, yes, sir.
Yes. First, thank you all for being here. This is it's really enlightening to hear you talk, and I see you brought backup over here, so I'm gonna make this brief.
Well, yeah. Right.
So much of what you're talking about in terms of your wish list, it would require policy change and changes in funding. There is a perception, right or wrong, that law enforcement votes one way, and that impacts how candidates campaign for the law enforcement vote. And I think it also impacts how they speak about what they perceive as being important to law enforcement. So my question is there an opportunity for the Fraternal Order of Police to lobby for the changes that you're talking about and to hold elected officials and officials who want to be elected, to hold them accountable for committing to do those things, because it feels sometimes like they speak to a caricature of who they believe law enforcement is, but they're not speaking to the things that impact law enforcement on the street every day. And I could be wrong about that, but is there a way that the Fraternal Order of Police can help to advocate for the changes in the wish list that you're talking about?
Yes, okay.
Yeah, go ahead.
Okay, I'll go first. We don't have much interaction with the Fraternal Order, but I belong to the Mississippi Chiefs of Police Association. We have 2 conferences, one in the summer and one in the winter. At that time, all the chiefs of police in the state of Mississippi, not sheriffs, they have their own organization, chiefs, we talk about our legislative ask going forward. We actually go collectively to the state capitol to push that agenda. You know, sometimes the narrative when you're talking about law enforcement is law and order. Law and order. You know, there's so many things that we respond to and deal with every single day that has nothing to do with law and order. Most of the time, we're going to a home with a grandmother who's doing the best to raise her grandson, but she's having to lock herself in her bedroom at night to make sure that nothing happens to her, right? So those are very real issues. What I've seen is that we have to be honest and have honest conversations. You know, one thing I say all the time, and I don't know what the future holds for me, but me being the chief of police has shown me I don't want to ever get into politics, all right? Because I've seen it up close, right? So with that being said, you're right, sometimes people push their agenda and they force their agenda on you. But when I'm in those meetings with the other chiefs, issues that are going on in South Haven are not applicable to Jackson, Mississippi. Issues that are going on in Harrison County and some of the other places across the state of Mississippi, or when I talk to the chiefs in Greenville and Greenwood, places like that, there's sometimes a smaller version of what's going on in Jackson, but the issues that I'm facing are way different than what's happening in some other places, DeSoto County, in the state of Mississippi. But we all have to come together and agree, all these 200-300 chiefs, about what we're going to focus on as the legislative session comes into play. And you know, sometimes the things that I think are important to me and the citizens of Jackson are not being addressed from the state level. But I do see change. I do see a collaborative effort. Chief Bo Luckey and I work in lockstep together. That's something that's never happened in Jackson. You know, I work in lockstep with the sheriff. I work in lockstep with our federal partners. We all have skin in the game. So to answer your question, I know I went a roundabout way. I think that we as leaders have to stand up and be vocal about what's important to you and the people that you lead and the people that you serve. And I tell my team all the time, when I'm behind that podium with that camera in my face, it's a very lonely place sometimes, right? But I stand for what's right, and it's always the right time to do what's right. Thank you.
Thank you.
So for me, with the Sheriff's Association, we have a legislative committee where we go and we have a lobbyist also, where we would like to push things that we see that can help law enforcement, but not only about law enforcement, we're talking about social issues also. And not only that, you know, out of the 3 of us up here, well, 4 of us, 'cause technically she's up here with us on 4. When I say law enforcement before, I'm the only one that's here that's actually in an elected position, right? So with me being in an elected position, you know, it's about what you can do to support your constituents also, right? To make sure that you have good legislation. Make sure that you are lobbying those that are responsible for legislation and the taxpayers' dollars, right? There's no such thing for me as red and blue, right? Money is green and resources are helpful. I don't care which side they come from. We need the resources, right? So we can't get in the position of making this about politics, right? We've all gone up there individually and testified before these committees. And as a result of some of our testimony, there will be laws on the book effective July the 1st this year based on some of the testimony that we provided, that the legislative saw fit, that will help law enforcement, but not only help law enforcement, but that will help the community and people in the community that's suffering also. So it's an ongoing effort. It's very fluid. It goes from year to year, and sometimes it may go from day to day. It just depends on what the issue is and who are responsible for making sure that we have the resources. So it's not about us, it's more about how can we help and how can we benefit the people that we serve and the people that we come in contact with on a daily basis.
Yeah.
Awesome. Thank you. Thank you. And thank you so much to our panel. Chief Wade, when I had the opportunity to meet with you and your team in your office, along with Dr. Glenn and a representative of Emergent Biosolution, who's the maker of Narcan, when there was something that you said that really has just resonated with me, and I've often thought about it. You had officers who are going out to do recovery. What agencies are working with you when you're out, you're recovering drugs, you're going on a scene, you've got needles, exposed needles, and all kinds of things that's in the space? And I'd just like to pose that to the panel. Certainly we talk about relationships with community, and hopefully with the Glenn Family Foundation, we've talked about some things that we'd like to do moving forward with your vision of some bringing community leaders together. But can you all kind of address that in terms of your preparation for that? And explain to our audience what I mean by recovery.
Okay. First of all, thank you for the question. And that question has a lot of layers to it. I'm going to try to hit every layer. But when we're out there in the field and we're responding to these situations, outside of law enforcement, whether it's NBI, NBN, Hines County, JPD, you know, the only other people out there is going to be AMR and the firefighters. Right? We're the ones that are first on scene to deal with these situations. You talk about needles and these health issues that we face. The Hotel O we know in Jackson, there was an eyesore right there on the main corridor of I-55. Me and my team went out there to see what was going on. We were greeted by a lot of homeless people suffering from mental health issues, and people that were addicted to drugs who were living inside of this dilapidated structure. But as we made it to the front door, I decided not to enter. You know why? Because all the needles on the floor. All the needles on the floor. So I'm like, I've seen enough, right? Let's back out. Let's try to get them some help and get some resources. So I leveraged everything that I had, including speaking on site with the media there, to talk about this crap needs to come down, because it's affecting everyone's life in our community. I would love to see more community involvement when it comes to dealing with these issues in our community. Because first of all, we've given out awards to Jackson police officers who have actually saved lives with Narcan. Saved lives. They've gotten lifesaver awards for simply doing what they were trained to do. But we need these partnerships to make sure they're equipped with the Narcan to administer to it. We had a partnership with UMMC and some other organizations that provided us with it. But with most things, it's not an issue until it's an issue. We don't have any funding or resources just to go out and buy it. So we depend on these partnerships to be able to get the Narcan to save lives in our community. You know, we have all these toys and gadgets that we wear on our gun belts, tasers, collapsible batons, OC spray. But I would dare to say that Narcan is probably the most important thing you can have on your gun belt to help save people's lives, because you see it every single day. We're not doctors. You know, my background is criminal justice. I know nothing about medicine except take it when I'm sick, right? but the same thing with officers who are responding to these scenes. They have to make life and death decisions. Like that. They don't have time to think about it. Well, let me call a town hall meeting and let me discuss it. No, they got to make a decision right then and right there. I look forward to community partnerships, public-private partnerships, law enforcement partnerships, which we have, but also with our elected officials. Let's make an investment. Let's buy the Narcan. Let's make sure these officers are properly trained on how to administer it, not only for the people that we come in contact with, but for us. When an officer touches some type of drug, these drugs these individuals are making and manufacturing in these houses, they touch it and they could die. If we don't have the proper training and the proper ways to reverse this, we're going to lose law enforcement to this. I've seen it. I've seen training videos from officers across the country who collapsed after touching or interacting or entering places, you know, where people is using drugs, making drugs, needles on the floor. So it's very important. I could talk about it all day. I'm very passionate about what's going on in our city. I'm not just passing through. You know, I've grown up in the Jackson Police Department 30 years. And what I see is going on is hurtful. Not only to elderly people, but to people who are not going to ever get the medical help and treatment that they need because they don't have the resources to get it. But also what's more hurtful is seeing the next generation coming up the ladder. As the sheriff stated, they're graduating. They're climbing the ladder, and we'll be dealing with them. And you don't want to have to deal with them at an intersection or a red light or in a parking lot at night. Thank you.
Thank you. So, thank you, Chief Wade. We're out of time. Does anyone else have any pressing comments they want to make before we? But I want to just thank our panel today. We want to thank Dr. Hodge for being here. She's on the front lines. But I certainly want to thank our law enforcement people. You see that they work hard to keep us all safe. Now, nobody wants to be stopped by the police. but everybody wants to call if something's going on or if you're fighting or you're in a bad situation. I was in my clinic one day and a guy came in and he was obviously having a psychotic episode and they said, Dr. Gordon, you're the psychiatrist. What do we do? I said, call the police. So, but thank you guys all for being here and let's give our panel a hand.